What's up everybody? Remi Sovran here, back with another video today, and what I wanted to talk about is an issue with a lot of the lower back pain studies being conducted and developed today. And I've talked about this before briefly in previous videos, and I've made separate videos on kind of the issue with studies that are being done specifically on lower back pain, but in specific regards to swimming and yoga, and I've used those as specific examples. But the issue begins with conducting a study on treating someone's symptom, which is being lower back pain, and not actually conducting a study on the issue or the cause of the individual's lower back pain. So what ends up happening is we have a bunch of researchers that may conduct a study where they're trying to maybe find some sort of treatment program for lower back pain. Now, the reason why you're using lower back pain is because it's a large population or large group that individuals can use. Now, like I mentioned before though, everyone's lower back pain symptoms are going to be different. Some people may have issues with bending over. Some people may have issues with going into lower back extension. Some people may have issues with walking. All of their causes of pain are going to be different, and the symptoms of pain are going to be different based on their mechanics, or maybe they have, in extreme cases, they may have a tumor which would only be detected based on the necessary tests a doctor may administer. Now, that's more extreme, but just going back to kind of the mechanical factors, the point being is that when we're developing a study for treating lower back pain, some people may get better with whatever treatment program that they're using, and some people may get worse, or some may just not get better at all and may see no results. And that could be seen in yoga studies on treatments of lower back pain, swimming, or any other treatment program out there or exercise program that an individual or kind of group of researchers may be using. And another issue is oftentimes a lot of these researchers that are coming into this often have a bias. And so they're looking to actually find a solution, or for instance, if using yoga for an example, if the researchers are trying to determine if yoga is effective in lower back pain, they're already coming in with a bias essentially because they kind of want to get those results. They want to prove that yoga is beneficial. Now, I'm not going to say that's for every case, but oftentimes you do get that bias occurring with research. And so what you may see is that maybe in the statistics and the conclusion, a lot of people got better, but they don't know exactly the cause of their back pain, and maybe not everyone's getting better, and there's some people that could actually be getting worse. Point being though, this kind of carries over to clinicians now, and clinicians that aren't exactly 100% experienced in treating people with lower back pain, is what ends up happening is that when clinicians kind of see this research and they see that yoga is beneficial for lower back pain or swimming is beneficial for lower back pain, clinicians that don't fully understand lower back pain or kind of the treatment that needs to go into it and kind of the evaluation and assessment, they may quickly recommend something like swimming, yoga, or whatever treatment program that they saw that was helpful in some sort of research study for lower back pain. And they'll quickly recommend that to that individual, and then that individual may go and do that activity or whatever was recommended by that clinician, and they end up getting worse. And then we wonder why people get worse with this whole system. And as we could see, guys, everything, in a sense, has its flaws. There's all these flaws all over. We could look at the clinician just being inexperienced. We could look at the researchers looking to find a result in terms of treating a symptom and not actually the cause of the individual's injury or pain. And it just kind of all ties together, is my point being, and it's why the system is essentially flawed. And it kind of starts with treating the symptom. Treating the symptom, it all kind of just kind of ties back to that. And that's the way kind of the medical model, in a sense, is designed today, is where we're treating people's symptoms and we're not actually working to address the cause. Now, that's not in every case, but in a lot of cases it is, and it's many reasons why people end up getting worse. And then you wonder why people get, multiple cortisone injections, or they're going to pain clinics and they're being prescribed heavier doses of opioids and pain medications, and then all of a sudden they become addicted to it. Now we have the problem with addiction occurring, and now these people become depressed because they're not getting better, and they keep needing to take these pain medications, and things are only getting worse. Then we wonder why we have an increase in an opioid addiction. The whole thing is kind of just all tied together, is the point I'm trying to make. And in a sense, it does start with the research being conducted, but also with the mindset of treating the symptom. But anyways, the purpose of this video though was to just address an issue with the research being conducted today, is that we're looking to kind of treat a large population being lower back pain with one kind of treatment program, and we're trying to address everyone into that group. Everyone with lower back pain goes into that group, and we're trying to essentially address that whole group using one program. We're not looking at the individualization aspect. I'm not saying this is every research study, but this can be specific to a lot of the research being conducted today. And it's a problem why people aren't essentially getting better and maybe getting worse, is because of a lot of the flawed research out there and a lot of the issues with that. And so the point being, guys, is if you read a study regarding lower back pain, or you found some sort of a study that showed this treatment program was effective in treating these people with lower back pain, take it with kind of a grain of salt. I'm not saying completely write it off, because there may be some beneficial things in there to read or that may be helpful, but take it with a grain of salt, because it may not be applying to your case specifically. And essentially it isn't for a lot of people, because again, you're looking at the symptom lower back pain. You're not actually looking at the injury. Is it stenosis? Is it a disc bulge? Is it an SI joint problem? Is it a facet joint problem? And it just all kind of ties together, and be careful with the research you're reading regarding that. And point being, just be careful with the information out there, as this kind of all ties in together, guys. And then what ends up happening is you see a lot of these research studies get promoted on mainstream media and mainstream sites. And then this is how people end up learning about these studies and these treatment programs for lower back pain, and then they go do it, and then a lot of people end up becoming worse, and we wonder why. So anyways, that's my point, guys. Just wanted to address that quickly. In this video, I just wanted to talk about that problem with the research today on lower back pain issues. And I mean, this can be applied to a lot of other cases as well. This just doesn't have to be lower back pain. I mean, this could be maybe even hip pain, knee pain, shoulder pain. I haven't looked into that stuff, so my familiarity revolves around lower back pain, and that's where I kind of stick to. But it could be applied to other issues or injuries, even diseases for that matter. But just wanted to kind of talk about that, guys. And if you have any questions, comments, or anything, please leave them below. Please leave them below. And maybe if you're someone that stumbled upon a study or some research study, you kind of read up on it, and maybe you followed that treatment program or whatever they maybe have recommended or found to be helpful in lower back pain, and it actually made you worse, would love to hear about your experience and how that was for you, or maybe if you got better from finding that study or whatever. Okay, guys, so that's it for this video, guys, and I hope you guys enjoyed this. And until next time, all the best and take care.